Welcome to Total Spectrum Spotlight, an informative look and an insightful discussion of today's legislative issues and political trends.
Hi, everybody. I'm Congressman Paulsen, and welcome to Total Spectrum Spotlight. We all know that telemedicine and telehealth have helped expand access to care for patients all across the country, something that many of us have used ourselves in the wake of the pandemic. Today, we get to talk with Kyle Zebley, who is the Vice President of Public Policy at the American Telemedicine Association, where he leads a team working to eliminate barriers to the expansion of telehealth and ensuring that providers and patients and payers can all realize the benefits of virtual care. Kyle, thanks for joining us today.
Thanks so much. It's great to be here, Congressman.
Well, look, for years, advocates have talked about the power of telemedicine, yet despite all of the political support from advocates and from parents and health policy experts, technology leaders, and even providers, it took a global pandemic to get telemedicine covered and deployed to most Americans. Maybe talk a little bit about what was included in the president's declaration of a public health emergency, that allowed these services, and why is this important?
It couldn't be more important, and really the last 2 years have been, to use a phrase commonly used in the telehealth community, a game changer. And really telehealth has proven to be the silver lining of the pandemic. What we saw happen early in the pandemic were obstacles being lifted that had long been an impediment to telehealth access. Most notably, of course, the biggest federal levers that the Congress and the president could pull was ensuring that all Medicare beneficiaries had access to virtual care services wherever they were. That was certainly not the case. Only a small, minute number of Medicare beneficiaries had access to virtual care services prior to the pandemic. It meant that patients could receive remote prescriptions of certain controlled substances wherever they were. There had been in-person requirements mandated by the Drug Enforcement Administration and by Congress prior to the onset of the pandemic. It meant that there were other obstacles that were removed for virtual care and other inducements put in place. For instance, the waiver of HIPAA privacy restrictions so that all telehealth platforms would be automatically compliant with the law because of enforcement discretion coming from the Department of Justice and the Department of Health and Human Services. All these were tied in with the public health emergency, and there are several other factors as well that really have meant that the entire landscape in terms of federal telehealth policy has been changed. It has been temporary in nature. There really has been no real permanence for most of these programs. And so we've been living under this public health emergency authority now for 2+ years.
It's interesting because you talked about Medicare beneficiaries receiving these services and then obstacles being removed. So why haven't some of the provisions for telehealth been made permanent?
Well, it's an extraordinarily popular issue for constituents, for members of Congress. They're supportive of telehealth flexibilities across the board on a bipartisan and bicameral basis. We're a healthcare issue that had strong supporters in the White House on either side of Inauguration Day. The community is so appreciative for what President Trump's administration did to get as much access to virtual care as possible out the door during the pandemic. And a lot of the public health emergency authorities have continued to be renewed by this administration, by the Biden administration, who were strongly supportive of telehealth. So it's a great question. Why isn't it permanent? Congressman, as I think you understand as well as anyone, even on popular issues that have bipartisan support, it's hard to get things done in Congress. I think that questions of costs and questions of the full implications of making this all permanent are genuine and genuinely being asked by policymakers. But I just think that the idea of getting standalone pieces of legislation through the committee process, through a full floor consideration, and then swapping out differences in a conference committee, that's how we'd like it to work, but it often doesn't work that way. And so Congress often pursues the path of least resistance. They've kept these flexibilities in place through the executive branch's actions. So there's no huge impetus to act right now because we're not going off that telehealth cliff in the near term because the PHE continues to be in effect. Congress has acted on a few areas. They've made telemental health permanently part of the Medicare program. They've also acted to to ensure there's a degree of flexibility for 151 days post the pandemic through a recent omnibus bill. But I think that they're going to perhaps go through a couple more extensions prior to making it permanent, just because of that's how Congress now works in this day and age.
Sure. And so you referenced the fact that some of these provisions were extended by Congress as a part of their omnibus bills they passed even as recently as March. But there is some legislation out there to make sure that this is permanent with bipartisan support, correct?
Overwhelming bipartisan support. We have all the right pieces of legislation that would hit all of our key objectives of making permanent the flexibilities that have come about during the pandemic. For instance, really notably, a bill that's been introduced many Congresses running, including prior to the pandemic, but it's been updated since the pandemic, is the Connect for Health Act, which Senator Brian Schatz and Senator Roger Wicker lead on in the Senate, and Congressman Mike Thompson leads on in the House. And it would really make permanent a lot of these geographic and originating site flexibilities that are so important. And really importantly, it's got a filibuster-proof number of senators that are co-sponsors in the Senate. It's 2/3 of the Senate has signed on. So we've got all the right bills in place. We've got all the right support from the key power players. And so I think it's just really a question of when, not if, we'll extend for a period of time and then make permanent the flexibilities that have come about during the pandemic.
Sure. And I'm not sure if this provision is in the bill you just mentioned, but we do know that one thing that was left out of prior legislation passed in March was this issue of remote prescribing of controlled substances, because I think certain prescriptions, right, are done on an everyday basis, and some you normally need an in-person visit once a year before getting that prescription, correct?
That's absolutely right. So as the law that stood prior to the pandemic, and one of which has a restriction, an in-person requirement before you have that ability to prescribe controlled substances remotely, that in-person requirement's been waived during the pandemic. That means we have a huge cohort of patients for a variety of purposes through a variety of medically appropriate controlled substances receiving care virtually. We want to make sure that continuity of care isn't interrupted. We had hoped to include a continuation of the waiver in that omnibus package that you mentioned that was passed into law in March. It was left out for a couple of reasons. The dynamics are unique. Committees of jurisdiction don't really overlap with the other telehealth flexibilities. It tends to be, for instance, more involved with the Department of Justice issues because the DEA is involved. Congress has spoken on this prior to the pandemic and asking for the DEA to come up with a rulemaking process that would allow for a special registration that would allow for continuation of remote prescriptions without an in-person requirement. DEA's dragged its feet, though. They haven't implemented it for a variety of reasons. We've had now this 2+ years of experience knowing that it's been a success. So we think it makes a lot of sense for Congress to package this flexibility up with these other telehealth flexibilities moving forward. But having failed to do that in March, it's incumbent on us to continue to make that case to Congress, and concurrent to that, to make our case to the administration and to the DEA that they should do whatever they can within their authority to most reflect the current posture, to make sure that these underserved and vulnerable communities receiving these prescriptions aren't left behind.
It makes total sense. And you talked a little bit about, obviously the legislative side of the equation, and then the regulatory and the bureaucratic obstacles to this as well. And maybe you can touch a little bit about some of the dynamics surrounding telehealth, telemental health, because this has been obviously an issue that has been, I think, highlighted as a part of the pandemic. But tell us what's going on at the federal level. Is there financial support for telemental health at the federal level?
Yeah, so Congress has acted a few different times on telemental health, which, we're the ATA is a modality and service and technology and location neutral organization. We really think that the standard of care is king, and it's up to licensed medical professionals to determine the modality and the service that can be successfully done via virtual care, if they can meet that standard of care. That being said, of course, it's very obvious of the huge uptake in utilization of telemental healthcare for those services. It's particularly effective and flexible to meet the needs of folks that need help. And of course, when you combine that fact, its flexibility and its clinical appropriateness, with the fact that we have a huge mental health provider shortage across the country, it's clear that telemental health should be here to stay post-pandemic. There has been support for it. Actually, telemental health is a permanent part of the Medicare program. That was passed into law in one of these big other omnibus packages at the end of 2020. And we, of course, rejoiced when we saw that. However, it includes something that's an existential threat to the telehealth industry that we oppose at both the federal level and state level, and that's an in-person requirement. I've been talking about in-person requirements for remote prescribing of controlled substances. Now, moving forward in a post-pandemic, post-PHE environment, unless Congress acts, we're going to have a mandatory in-person requirement for telemental health. That doesn't make any sense. That doesn't allow for the full potential of telehealth to take place. It's really a barrier to care. It really exacerbates that mental health provider shortage I was mentioning earlier. So one of our top priorities is seeing that's permanently removed. We were able to forestall its implementation in that March omnibus package, where for 151 days post-pandemic, that in-person requirement won't take effect. We want to make that permanent. But also something else that's happened since a couple of tragic incidents over the last few months was movement towards really strongly supporting mental health services through Medicaid and the CHIP program, and also through direct aid to states. And that was one of the features of the recently passed gun package, and certainly something that we're happy to see. A lot of the obvious levers that the federal government can pull is for Medicare programs in particular, and that's been one of the most notable during the pandemic, but also the states and the federal government working in concert can really make a real difference here to make sure that this huge mental health shortage for a need for youth and for families is met. And the Congress took a step in that direction through the recent gun package.
Sure. You mentioned states having a role in this too. And it's interesting. In our final question, I'll just ask you this. Even the Supreme Court decision, recently to overturn Roe v. Wade impacts the space we're talking about right here. I mean, maybe just real quick, talk a little bit about what this could mean for telehealth.
Well, so as I mentioned a few times so far, telehealth has been a bipartisan issue that the support of which has spanned multiple administrations, the support of which we see in red states and blue states. We've been able to pass really successful laws at the state level over the last 2 years, seizing that momentum coming out of the pandemic. We, of course, as an industry, seek to maximize that support and get as good telehealth policy as we possibly can, wherever we can get it at the federal level and state level, working with all comers, because there's no American that doesn't stand to benefit from access to telehealth care. The recent Supreme Court decision, of course, could upset that dynamic if we don't handle it correctly as an industry. And what I mean by that is that it really could be an area where we could start seeing some divisions in our wonderful big tent group of supporters. We don't want that to happen. The industry will be very mindful that regardless of whether or not policymakers are pro-life or pro-choice, we're working with them to maximize their support for broader telehealth services. And as they consider what to do moving forward post Roe v. Wade, post this Supreme Court decision, we just hope that they keep in mind that this can't be a single issue and that we really need to continue to work with patients and members of Congress and members of state legislatures and members of the executive branch at the federal level and state level to maximize that support for telehealth now that we're in this new world created by that Supreme Court decision.
It makes total sense. And so you've got to navigate a lot of different obstacles and take into account a lot of different perspectives. We're running out of time. It's all the time we really have today, Kyle, but really thanks so much for shining a spotlight on an issue that's important to improved healthcare access and outcomes and affordability ultimately. So we really appreciate it.
Thanks so much, Congressman. And you highlighting this issue, I think, really is important, and we need to keep the dialogue going. Just because these flexibilities have come about and are popular doesn't mean that they're here permanently. So just hope that viewers and listeners today will go back to their members of Congress and go back to their state legislatures, do what they can to really make sure that those folks know that are in places of power. Don't let us go off the telehealth cliff. Make all these popular provisions permanent. There's no time like the present.
Absolutely. All right. And thanks again. And to all of our viewers, we'll see you next time on Total Spectrum Spotlight. Have a great day.
Thank you for watching Total Spectrum Spotlight. For more information about Total Spectrum, please visit us at totalspectrumsga.com. Total Spectrum, strategies uniquely focused on your success.